Migisha Richard. I'm the principal investigator for the ZOHEC project. And ZOHEC stands for Zoonotic One Health Engagement and Communication project. And we are in southwestern Uganda. And one of the activities is raising awareness in the city slums about hypertension, which is high blood pressure, and diabetes, which are high blood sugars. So he has said, how did I get the money? Coffee. And I want someone to tell me what the coffee stand is for. We have some precious people here, the alumni. I think.
Good morning, everyone. Thanks for being here. And we welcome all of you. I'm called Gloria Magoba, an alumni for KOFIH. KOFIH stands for Korean Foundation for International Health Care. We welcome you.
Thank you. Foundation for International Health Care. So those are our sponsors. That's why you see our t-shirts. I take this to welcome you to this event, to this campaign. Maybe let's do very quick group introductions. We have alumni of the Lee Jong-wook Fellowship Program, which is supported. Yes, and alumni, you join me now here and we take a group photo because we have started. You come here as I'm talking so that we don't lose time. And yes. Yes, we need, these are the alumni. They are from the different parts of the, I think let's do a quick introductions. Tell us your name, these are professionals. So your profession and where you are working quickly, and we move around.
Hey. Good morning. Beatrice Oling is my name. I went to Korea when I was working in the hospital in Masaka as a senior hospital administrator. But now I work in President's office as a principal assistant secretary. So when you're an alumni, wherever you go, you remain an alumni.
Good morning, everyone. My name is Patrick Semanda. I work as a lab technologist at Central Public Health Laboratories under the Ministry of Health. Thank you.
Good morning, everyone. I'm called Peruth Ochan. I work with the Ministry of Health as an administrator with UNEPI, EPI. Thank you.
Annyeonghaseyo, that's how they greet in South Korea. My name is Dominic Muhereza, lab technologist in Mbarara Regional Referral Hospital.
Good morning, everyone. I am Dr. Mona Alphonse. I'm a general surgeon. I head the trauma center at Masaka Regional Referral Hospital. And I was a principal investigator in the previous project. He's my twin now. He follows me. So my project was in developing and implementing the Uganda trauma assessment and treatment algorithm. It is a treatment algorithm that we use for assessing and treating trauma patients in the emergency department. Since you are all health workers, soon enough we shall come and train you as well. Thank you.
Thank you. Let me also take this pleasure to introduce myself. I'm Dr. Migisha Richard. I joined the fellowship under the Infectious Disease Epidemiology and under the Uganda National Institute of Public Health, UNIPH, Ministry of Health.
Once again, you're welcome. I'm called Gloria Magoba, KOFIH alumni. I also joined KOFIH in 2019 and Health Administration. Apparently, I'm working with Ministry of ICT.
Good morning. I'm Regina Mugisa, and I work at Kabale Regional Referral Hospital as a principal hospital administrator. But before that, I went to Korea in 2017 and I've led a number of projects under KOFIH. One of them is setting up a youth corner at health facilities in Masaka. And then also, I led the project on mobile application system that was also still in Masaka. Thank you so much.
Good morning, everyone. I am Atiang Elizabeth. I work in Mulago National Referral Hospital Emergency Department. I went to Korea in 2021 as a clinical expert. Thank you.
Good morning, everyone. Pangapsmida. Thank you all. So I'm Hashaka Alex, a lab technologist. I work with Maxwell Regional Hospital, and I went to 2023 with Dominic and Patrick and Dr. Gisha. So we are happy meeting you.
Good morning, everyone. I'm Dr. Victoria Zarango. I work with Masaka Regional Referral Hospital. I went in 2021, I think. I'm a co-developer of the Tutata project, and we're happy to be here, and I'm currently doing my master's in pediatrics.
My name is Marjorie Nazua. I'm a nursing officer at Bukoma Nsimbi, and I'm an alumni. I went to Korea in 2020. Thank you.
Okay, thank you very much. Can you confirm that you have taken the group photo, please? And then I release this big. Our photo has this one. What is this sign?
Heart.
It's the sign of the peace. Okay. Yes. Kimchi. Okay. Great. Thank you very much. So you can see it's a multidisciplinary team. We have administrators, we have epidemiologists, we have laboratory technologists, clinical experts. And now I think I have welcomed you. I think, Abraham, you read us into how the program is going to flow so that we don't lose time. Yeah, you clap for me also. In the Korea we say, Kamsamda. Thank you. Kamsamda. You reply, Ne. Ne means yes. Okay. Yes.
I think I should also become an alumni. Yeah, so thank you so much, the KOFIH team and the alumni, for taking us through this session. I think they are inspired to see these great men, the surgeons, the epidemiologists, and the other professionals joining us. So right now, the next on the agenda, we are going to have a group photo. Everyone, make sure you put on your t-shirt, your cape, and we are going to go outside and have a group photo from outside. Then after a group photo, we are going to have like 7 minutes of recordings with the alumni. So in the next 10 minutes, we should be able to settle from here. The band is waiting for us outside. People who are supposed to march, you should be ready. I think everyone here really was supposed to march. 1 hour of marching. So I call upon everyone to move outside. Look, I hope we are done with distribution of t-shirts. Yeah, so let's get out and we have a group photo.
So next we are going to have the panel discussants, but allow me to first recognize, this event is sponsored by KOFIH. KOFIH stands for Korea Foundation for International Healthcare. And we have a representative, Mugabe Emma. Please kindly stand up for recognition. Let's clap for Emma. Yes, the one we are looking forward to your remarks later on. But now let me invite, this activity is an alumni activity for the KOFIH Global Alumni. KOFIH supports so many countries in Africa, Asia. So actually, so now this is for Uganda. Every year there is a grant that goes through and is sponsored. Last year, the one that went through was called the Tutata. Tutata Youth, the grant winner is here. I went to support him. I said this time we also must revenge. Anyway, in a good way. So tell us Tutata so that we have that context and then move on. Tutata.
Thank you very much, ladies and gentlemen. I'm very happy to be here today. I am Dr. Mona Alphonse. I'm a general surgeon at Masaka Regional Referral Hospital. I head the emergency department and the trauma department as well. Briefly, this program, just like the one I had last year, the Uganda Trauma Assessment and Treatment Algorithm, was sponsored by the KOFIH, Korea Foundation for International Healthcare. So TUTATA is the Uganda Trauma Assessment and Treatment Algorithm. I know many of you have been either a victim or you have suffered from traffic accidents in one way or the other. And either you have treated somebody at the emergency department or you have seen someone being treated at the emergency department. So what we did was to develop a treatment guideline which health workers can use in the emergency department. And this was sponsored by KOFIH. We trained the staff at Masaka Regional Referral Hospital, and they went back and they saved many lives. Actually, there was a reduction in preventable trauma mortality from around 32% to 6%. So it is a big thing. And I'm confident ZOHEC will also lead to significant reduction in zoonosis. Thank you.
Thank you so much. So this year, the vote went to One Health because we are in emergency services. Now this year we said One Health, let's also write very well. And that's how we came here. But they said the non-communicable diseases, you also, now that you are in southwestern Uganda, can we also raise awareness or no? So this is just one objective of the bigger zoonotic One Health. And that's why we partnered with the One Health Students Innovation Club to, also looking at sustainability of these interventions going forward. So actually, Dr. Mona, you are one of our panel discussants. Please have your seat there. The other, Dominic Muhereza, you are also a panel discussant. The panel discussants are alumni for KOFIH Global Alumni. Yes, Atiang, Elizabeth, you come and who else am I missing here? Yes, Dr. Victoria, you are on the panel. And we want to discuss about the zoonotic not zoonotic, the NCDs, the non-communicable diseases, especially hypertension and diabetes. So I think we are going to start with Dr. Mona.
of the mortalities that happen, they are caused by this non-communicable disease. You find there's hypertension, there's diabetes. So when they present, they are having either cardiac arrest, diabetic ketoacidosis, they are in shock. So, and because the number is big, it is important that we get down to the root and make the people understand. And you being the ambassadors out there, we want you to get a bit of this and share with the community. So there are very many non-communicable diseases, but we are picking up diabetes and hypertension. And as far as diabetes is concerned, it is a condition in which your body is not able to process the sugar. So what do I mean by processing sugar? It is the actual sugar which you eat, the one you put in tea, the one you put in coffee. The other form is the one you eat in matoke, in cassava, in millet. So when it gets into your body, it is turned into glucose. And this glucose gets into your bloodstream. So the body has mechanisms to keep it within normal ranges. So when your body is not able to keep the glucose within normal ranges, especially to lower it down, because you are always eating, so the glucose tends to go up. But your body has natural mechanism by production of insulin, which keeps it within normal ranges. Now, when you have problems associated with keeping your glucose within normal ranges, that is a condition where the glucose goes up, and that's what we call diabetes. Now, hypertension is the high blood pressure. So it is just pressure. I'm sure all of you know what pressure is. Like when you go to your tap to fetch water and you open the tap, when the water is flowing very fast and very strong, that is high pressure. But then when it's just coming very slowly, it is low pressure. So it is the same thing. I'm sure many of you have cut chicken. When you cut the neck of the chicken, you see blood spitting out. Okay? So that the blood is coming under pressure. Now, this condition, high pressure, is that the pressure that is moving within your blood vessels is very high to the point that it affects your blood vessels. There are small, tiny blood vessels which are in important organs, like, for example, in the brain, in the heart, and in your kidneys. So those small blood vessels, they may not be able to handle very high pressures. So when the high pressure reaches there, they tend to burst, just the way you see pipe bursting by the roadside. So when it bursts, the blood will now start flowing. And in important organs like the brain, it causes stroke. When it does in the kidney, it causes kidney failure. And when it does that in the heart, it can lead to cardiac arrest or heart attack. So in simple terms, those are the two. Now, how common is this in this country? There are many studies that have been done, and for hypertension, it is around 25% of the general population in the country. That is maybe approximately like 13 million Ugandans having hypertension, and for diabetes is around 10%, maybe around 4 million Ugandans. And remember, when you have one, you are highly likely to have the other. So if you have diabetes, hypertension is just a matter of time, it will come. So that's why it is very important for us to be aware about this. Go out there, tell our family, our mothers, our fathers, our siblings, and our neighbors that hypertension and diabetes, they are killer diseases. They are actually silent killer diseases that we must prevent. Thank you very much.
Well done. Thank you, Dr. Omona. And he has used the pipe. You know, when they are supplying water, the pipe keeps dividing into smaller and smaller pipes. So even your body pipes, the blood vessels, they keep dividing into smaller. And those smallest of the blood vessels, they are called the capillaries. I don't know capillaries in Runyankore. Anyone who gets capillaries in Runyankore, I have a gift for you. Yes, but doctor, can you go ahead to tell us how these diseases present or manifest? Someone who has diabetes, which you have said they are persistently high blood sugars, and someone who has hypertension, which you have told us is persistently high blood pressures. What are the signs and how can we know that, how do these diseases present? I think you take on that and then we move to the next speaker.
Now, how do they present? I already said that they are silent killers. They are silent because they don't really give you any symptom. By the time the symptoms are coming, it is already late. And that's why having people to be aware about it is very important. Now, for diabetes, there are actually three key things. Number one, you feel thirsty a lot. And because you are thirsty, you drink a lot of water. Okay? So, excessive thirst, excessive drinking of water. And because you are drinking a lot of water, you also urinate a lot. Okay? You might wake up at night over 5 times to urinate. As you compared when you were normal, you might sleep the whole night and you're not urinating. But this time, you urinate a lot. And also you feel excessively hungry and you also eat a lot. Despite that your sugar level is high, you are still feeling hungry and you still eat more. This is because your body has lost control of the sugar level in the body. Now there are other signs that or symptoms that come as complications. For example, you lose your sense of sight. You might find you have some small wounds in your legs or in your foot, and you are losing sensations, especially in your fingers and in your toes. And because of that, you can get some wounds that you may not even be aware of until when it is much, much later. And also you might get excessively tired when you're doing your daily activities. Now, for hypertension, you may not see anything whatsoever. However, there are some, you may get some small headache here and there, but if it is not confirmed early enough, it might just present when you have already collapsed, you have already got a stroke. So that's why it's important for us to know this early. Thank you.
Okay, thank you, Dr. Umona, for telling us about these silent killers, the silent diseases, especially hypertension. Let's all get tested. I wish Derek had brought our machines. And before we go home, each of us knows their blood pressure. Isn't it? Because for the blood pressure has told us there may be no warning. The only warning you may get, you are down. And if you are down, you may not, there are two chances. Either you may get up or you may not get up. So you don't want to fall on the other side of not getting up for a disease that you can actually regularly test. Our next discussant is Dr. Victoria. She's going to tell us, Dr. Victoria, what actually causes these diseases, or to say, what are the risk factors? Who are at risk? Is it everyone that they are, who are these people that are more likely to get high blood pressures and high blood sugars?
Good morning, everyone. I'm Dr. Victoria once again. So when we're talking about risk factors, we shall start with diabetes. Remember, diabetes is categorized into two categories. We have type 1. Of course, there are many other types of diabetes, but the ones where we mainly focus on, we have type 1 diabetes and type 2 diabetes. Type 2 is the one which is later on acquired because of the increased insulin resistance, like Dr. Mona had said. And type 1, you have antibodies against the beta islet cells. So usually for the autoimmune type, the risk factor is usually genetic factors. However, there have been other studies that have shown that you have things like diary, especially early introduction of diary in a child's diet. So you have diary, then you also have infections like viral infections like measles, and then recently also COVID has been implicated in some few studies. So those are mainly the risk factors. So you have the genetic component coming in, but also you have those other environmental stressors that can really ride this for a child to get more predisposed. So usually when you have a parent who has one child with type 1 diabetes, you really want to watch out for the subsequent siblings, also checking them and making sure that they are fine, and also giving them the warning signs. Then for type 2 diabetes, usually it's lifestyle. And really, even in children, we are seeing type 2 diabetes coming in. And this is mainly contributed to obesity. We are having childhood obesity, which we didn't have years back. And then we also have type 2 diabetes is also linked to certain syndromes that are also associated with increased weight gain. So we have things like Cushing syndrome. Then we also have other syndromes also coming in that are associated with excessive eating, excessive weight, and excessive weight gain. So then for adults, really when you have a sedentary lifestyle, increased intake of, when you have a sedentary lifestyle, your body is not able to use that glucose that you are eating. You have a sedentary lifestyle, you are taking high sugar containing foods, so your body is not able to utilize the sugar that you are giving it. You are giving it too much than what it needs. So anyone, also as you grow older, you're getting fat depositions in the vessels, so even the utilization of the glucose really reduces. So moving on to hypertension. Hypertension, remember, is also, we have primary and secondary. Usually primary hypertension, the causes, it's not so common, and the causes really sometimes may remain unknown. Yeah, but for the secondary hypertension that we really want to look at, why we bring in diabetes, you all know that a patient with diabetes, no matter let it be type 1 or type 2, they are at risk of getting hypertension, because we know the effect of those high glucoses on our vessels. So as your patient has diabetes, you have to really watch out for them getting hypertension, no matter the type of diabetes they have. So already having diabetes is a risk factor for hypertension. And then we have things like, again, sedentary lifestyle, not exercising enough. As you grow, your vessels lose their usual, they lose their structure. The structure their elasticity becomes different. So some of them become thicker. They are not able to. So the blood is being pumped against resistance. So you are really at risk of getting high blood pressure as you grow older. When the more you don't exercise, you're at risk of getting hypertension. Then we have obesity. Obesity, really, you get a cocktail of so many other diseases. You get nerve damage, you are getting hypertension, you are getting diabetes. So really, we watch out for our health. We'll be more mindful as we take care of ourselves, as the things we do. Then we have alcohol intake. Excessive alcohol intake is among the risk factors for both hypertension and diabetes, because we know alcohol, the effect it has on the liver, on the vessels, and then also the effect it has on your pancreas, because alcohol increases your risk of getting pancreatic injury. So really, and then also many studies have also implicated excessive smoking, and this is really related to the increased risk of retention of the increased risk of having high lipid levels in smokers. Yeah, thank you.
Thank you very much, Dr. Victoria. And she has, she has been very fluent, if that is, I think that's the right English. But I want someone, before we have some physiologists in the house, at master's level, medical physiologists. I could see that some people here were, what is the lipid? What is lipid? What is autoimmune? So, because she has said there is some, Derek, you be coming in front. I have singled you out. You be coming in front. I want you to simplify further autoimmune, because these risk factors, some she has told us are modifiable, others are non-modifiable. And run away from autoimmune, tell us where the destruction and what type of destruction it is. And also, what else are you going to tell us? I don't know. Did you get the Runyakuri term for capillaries? If you have it, You can also win yourself an award. Yes, you simplify for the student doing agriculture. What is my friend doing agric? Hey, yes, there are people doing agriculture here. Yes, and also talk about diet. Diet. What type of what should we eat? Because sometimes they say we become what we eat or what. So tell us what's the best diet? Yeah, I think let's clap for Derek even before he by accepting to. Yes, Derek, you have the floor.
Thank you very much, Doctor. I will have to first thank all of you for the work. Again, Dr. Mona has mentioned about that when you have diabetes, you have increased risk, you have high appetite. So what happens when you have diabetes? There is, he has mentioned about insulin, which is not working. That's a hormone. But also we have another hormone that is called ghrelin. So ghrelin becomes uninterrupted, and because it is uninterrupted, it is normally works in balance with leptin. It is another hormone. So because now ghrelin is uninterrupted, somebody starts having excess appetite. That's how somebody is eating. And now when you are eating, the body now is not converting because you have less insulin, so we have a lot of that glucose in the blood, okay? That's why they test you and they say your sugars are very high, okay? Now, autoimmune, in layman's language, it means that the body itself is fighting itself, okay? The body produces normally we have the cells called white blood cells that are usually protect us from diseases. But now in this case, they come in a good way, but in the long run, they end up causing harm to ourselves. I will not go to the receptors, the CD4, the CD28, and 8. So that's complicated. But what you should know is that the body itself, in protecting you, they end up causing excess reaction that now causes harm. And autoimmune means that when it has come, the drugs can reduce its progression, but cannot cure. Are we together? Then for the nutrition, it is very much important to understand that nutrition is vital in diabetes as well as hypertension. Studies have made it clear that on your food, you should include fruits, vegetables daily. At least they say once a week. You understand? So when you're having a meal, we know that the reason why you included slum areas because they might be having low socio-economic status and not afford either fruits or vegetables on their plate in a week. So that's recommended. You should tell your mothers and relatives that at least in a week they should have fruits or vegetables. Then there is what I've forgotten, Victoria didn't mention, adding raw salt within already prepared food. Okay? It is known that salt is sodium chloride, and that sodium, when you take it, it has a capacity because we call it an active osmotic potential. It pulls water. When it pulls water, the blood increases, the total blood volume increases. And when the blood volume increases, for us, we say that also the cardiac output has to increase. So the heart uses a lot of energy to pump that blood. And in the long run, what she was talking about, that the stretchability of the blood vessels itself now starts loosening up because the body is overwhelmed. There is what we call hemodynamics. There is an amount of blood that the body should pump, the heart in particular. It should not exceed 5.6. The normal range is 5, but if the blood now exceeds 5.6 liters, it means that the the body or the heart is overwhelmed. And in the long run, that's how we end up getting hypertension. Are we together? Then small blood vessels in Runyankole have been in field, teaching, creating awareness. We have been using the word obusi obuchemunonga and orukutwara eshagama. Then twine n'obusi obuchemunonga oburukureeta eshagama bukagigarira omutima. So we have been using specifically the small vessels that take blood away from the heart. Okay? But it is really hard. The language is hard. But maybe one thing that I should highlight is that she talked about that age is a risk factor of diabetes and hypertension. That's true. Because normally our vessels, we have proteins and other structures that make our blood vessels intact. Are we together? Such that the body can maintain the normal mitosis, the normal division normally. But when we age, the normal division reduces. And science has it, or literature has it, that replenishing or changing the endothelial layers of those blood vessels has layers, the innermost called endothelial layers, that are replenished every after 5 days. Are we together? So as we age, the replenishing increases, that in 5 days, there is no changing. So which means that the type of layers we call collagen type 4 reduces. And in the long run, that's how these people have reduced compliance of those blood vessels to respond to the blood flow. Okay? I think that's enough. I thank you. Thank you very much.
Thank you for complying. He had reached compliance. So, but he has complied. The elasticity, the stretching. So you are saying the vessels become stiff, like Victoria was telling us. Thank you for, trying to recap. I think, and we shall have some questions from you at the end of this before we allow these people to resume their seats as well. So now let's move on, now that we have understood what the disease is, how it manifests, what are the risk factors and who are likely to get these diseases. But now these people are traveled, all these people have traveled by air so many times, and they have been to developed world, especially, at least I know everyone who has been to South Korea, yes, I don't know, Dominic, where you were. Tell us, were you in the capital? I think I was in Seoul, the capital. I don't know if we went to the village. But either way, anyway, you are in Myeongji or where? Anyway, it's a developed world. Yes, so what can we learn from the developing world about how they approach the prevention of these non-communicable diseases? Yeah, I want you to share your experience.
Thank you so much. Annyeonghaseyo once again. Dominic Mureza is my name. Dr. Mona said this is a silent killer. They are silent killers, diabetes and hypertension. And Dr. Victoria highlighted about the risk factors. So what we do best here in disease management is prevention. So after knowing the risk factors, so how can we prevent them? Number one, having community engagements to promote a healthy lifestyle. We have done one. I hope if you didn't sweat really, you have a problem. Alex was running ahead of us and coming and picking us. So that's one of the community engagement that we can promote, exercise. Then there are national campaigns, for example, to manage the risk factors Dr. Victoria has mentioned. For example, obesity, still exercises, then smoking, alcoholism. Now for the age risk factor, you cannot fail to grow. But when you're doing the other measures like exercising, eating well, one person said, if you don't make food your medicine, then medicine will become your food, and we don't wish all to be there. So let's make food our medicine. And what do we learn from these approaches? For example, these developed countries like South Korea are using. When I was there, I know something very unique, the public gyms. But I'm wondering if they bring public gyms here, the discipline in our communities. But this comes, with awareness and the importance of such facilities. Public gyms, they are along the road, the roadside, and they are freely accessible. If you're jogging in the evening, you go lift weights, you walk in the parks. There are parks that can be accessed freely. Alex was making use of them every evening. The Irsan National Park, you go there, you run, so you keep in shape. Then technology, we have to agree like they have advanced technology and it is made available to their citizens, but still these machines, the digital machines, they say for checking the BP, the glucose, they are not so much expensive. We can manage, at least you have one in a family. If we can go on a family tour and spend all that money, why not spend 50,000 and really buy a glucometer so that you be monitoring yourself regularly? Then the developed countries have a universal health coverage, the insurance, which makes health seeking affordable for everyone, almost everyone. One of our challenges that we are still facing here is accessibility to health care. It is very expensive. Maybe I will pick out one. For example, imagine you have a case in a family which has diabetes and you have to buy those medications for over, let's say, 20 years. It is really constraining the finances of the family. But at least if you have insurance and, it can make it affordable for everyone to access. So what do we learn from these approaches that these developed countries are putting in place to avoid such non-communicable diseases? So we have to advocate for regular checkups. It can be by us, like such programs or HEC, going down to the community, doing regular checkups, screenings, and promoting public developing strong public health campaigns to raise awareness of these conditions like we have just did, and I think Mbarara City has greatly benefited, at least even if they had forgotten about hypertension and diabetes, but at least now it has clicked into their mind that they have to observe their eating habits and exercise regularly to prevent such silent killers. Then leverage on technology. At least, back then, I'm a lab technologist. I'm not into, patient management, case management, but how they used to take the BP. At least one person couldn't, if you say, I didn't go to a medical school, it would be hard for me to take a BP, let's say, even of my family member. But now there are digital equipments which need at least little training that even someone, he himself, can administer such. Thank you so much.
Oh, thank you. The clap is very loud, Dominic. I think that's a good sign. And BP stands for blood pressure. There are people who say, what is BP? BP. It's blood pressure. I actually talked about universal healthcare coverage. I think, Dr. Gad, in your remarks, I will request that you touch a little bit. Dr. Gad is also my mentor. I did my Masters of Public Health from Mbarara University of Science and Technology. And right from undergraduate, this has been my university. So he's my mentor as well. So I know, from primary health care to universal health coverage, I am requesting that you give us a bit of how far and what is the implication for that also. In your remarks, I'm just requesting you slot it in there. Hashaka is a runner. Hashaka Alex, you stand up. He used to be bigger than me, but now when we were in Korea, for me, guys, you have been talking about obesity. Of course, I want to correct. It is not obesity. These days, the friendly term is weight gain. So for me, we can talk, the weight gain is a risk factor. So meaning we should be losing what? Weight. What you see here, you have actually lost. So that's why I say obesity now, it is stigmatizing. Let's talk of weight what? Gain. Now what you are saying obesity is called excessive weight gain. So Hashaka, he has lost weight. When I was there, he actually pulled me and said, "You man." I think one time I hit him and he bounced like that. No, he said, "You need to reduce this weight." Yes, so he helped me lose 7 kilos when we were there. And he's complaining that a few have come. But I want him to also supplement about, what made me, because you were my coach there, I lost 7 in 2 months. That was a very big achievement. And in the top of the realities there, on the top of your running, and you are running there compared to here, what can we improve? Also give us from the experience from South Korea, how is the environment?
Thank you, Richard. I think if it comes to running, I can talk till the cows come back home, like we say here. But to put what Dominic has shared in context, when you're there, I went as a runner. But the environment I found there, the facilities I found there, made me love what I do more. Why? The roads are safe. They are parked so you can go and run safely. Why those riding bicycles have their lanes, they are designated, that these are for the bicycles, these are for the runners or the walkers. And then there are public gyms. You run, at the end of the run, you go and stretch on those machines and you do the weights, a bit of weightlifting. But what was eye-catching is the fact that for them, they are veterans. For them, it's matter to go to the army training and everything. So these veterans, after the army training, when they get back to communities, they would now turn into trainers, gym trainers, freely. Today you have this guy training you, taking you through the drills. Tomorrow you find some other different guy, and they're all veterans, army veterans. Which I think we need to borrow from that kind of experience. And I think what the challenges we face as runners in this country are more to do with policy makers, especially the infrastructure. You cannot run safely from the way we walked. You cannot run this stretch up to Amambegente without meeting a border guy who abuses you. Even after getting encouragement on your walking pavement, they will abuse you on top of that. So I think from a personal perspective, we need to design safer roads which cater for all the road users, runners, walkers, and then have all the other infrastructures to encourage the communities to engage in those activities safely. I think he talked about the age, but there's also a bit eye-catching that in South Korea you find a 90-year-old, 80-year-old man walking every day in the park. Every day. Each lap was about 5 kilometers. And you'd meet this Muse, who is about 85, 90, walking. Each time you're running, you meet him doing another lap. Each time you're running, you meet him doing another lap. And for them, it's a culture that for them to stay healthy, they must do those activities, walk, run. If you can run, you run. Then you find families riding bicycles in a family. You find the father and the wife riding the bicycle. They have those two, how do they call them? The seats for the riders. It's a 2-in-1. The father is ahead, the mother is sitting behind him on the same bicycle, and then the kids are following, also having their bikes. So we need to kind of have those initiatives and have that kind of zeal and the urge to be physically active. With that, I think I congratulate everyone who has walked. You walked 5 kilometers, 4.56 kilometers. That's roughly 5 kilometers. So welcome back from the walk.
Thank you. So now we are winding up with the final panelist. Elizabeth, take us through from the context of law, and they have talked about policies. How can international collaborations and research, also help us to prevention of these non-communicable diseases? Over to you, Elizabeth.
Thank you so much. Operator. I am Atiang Elizabeth, Master's student, critical care. I work in Mulago, emergency department. So I want just bring now the conclusion of this discussion. The rest of my friends have talked about their experiences and what hypertension and diabetes mean. So collaborating with international countries brings a lot of advantage to us. Because for us who have been struggling with non-communicable diseases, who have been with infectious diseases, that's what we are based in. But for them, they have been managing NCDs for decades. So collaborating with them will give us that knowledge and expertise which we need to help us manage hypertension and what? Diabetes. Also, for them, they have technology, which is fab. It can help us also innovate in telehealth and telemedicine. We are in Korea. If you reach there at the hospital, you can't go there without booking. You book before you reach. And whether you're old or just born today, you have a national identifier, which has all your health information. You don't need to carry a book. You don't need to go with anything. Even if you collapsed on the way, someone just to help get that number, wherever you are, it can be identified and known which disease you have. So it reduces crowding in hospitals. So I think we need to learn from that and bring it down here and see, because we see sometimes, I give an example. My mom is a hypertensive. Will say we need only 60 people, but you've gone like 400. But you'll sit from morning up to sunset. Then at evening, they tell you, we're no longer taking in anyone. You can go back and come next appointment. You can see how it can give you hypertension itself. You who has taken the patient, and the patient will become worse. Instead, you will end up in emergency instead of being treated. But if it is the other system they are using, you book before you go. So if the number is big, they tell you don't come today, come tomorrow. Then the other one is the policy, building capacity policy and collaboration and advocacy. For them, they have policies. They have these policies which are favoring the management of hypertension and diabetes. For example, every public place has a defibrillator. Who has ever seen and used a defibrillator here? We are all medical people. Who can raise their hand? So for them, it is a thing which is used by the public. Every mall, every public gathering place must have a defibrillator. And people are taught how to use it. They also have a policy on managing hypertension, especially cardiac arrest. That people, the public is taught how to manage CPR, how to do CPR. That if you collapse from anywhere, you are helped by the people next to you. But in here, even if I collapse here, I might take some time or even become dead. In your hands. So people here will fear to even start CPR. But for them there, it's a mandate. Because even their policy is allowing them, you make sure that within 10 minutes, somebody who has gotten cardiac arrest must have gotten help. They have even air ambulance, which can reach you anytime. Because of the identifiers, they can easily have a geolocation where you are. You just need to make a call wherever you are, whether in your house, in 10 minutes. In fact, they want less than 10 minutes. You've been lifted to the nearest what? Facility. So such kind of policies can help us also improve our management of hypertension and diabetes. We have strengthening the health systems. For them, they have functional health system. The referral system is perfect. You cannot go to the National Referral Hospital if you have not moved the steps of referral. And their health center too looks like a health center 4. There is even ultrasound, CT scan in health center 2. If you look at their health center 2, it looks like our national referral. So if we improve and look at how have they strengthened that, because when we're there, they told us they were once like us. That's what they told us. We were once like you. Our emergencies were crowded. Our hospitals were in a mess. They even showed us pictures. But we moved in just 20 years. They moved to where they are. They are superb. Every time they would tell us to share experience of Uganda, we had no good experience to share. Because if Health Center 2 worked like our national referral, we were like, we are going to get there. That's how we would encourage ourselves. So we're so much interested in helping us. Collaborating with them would help us reach where we want to be. We have technology. My friend has just given you experience of technology. They have superb technology. And telehealth and telemedicine of South Korea is superb. That you go to the hospital, you don't have to look for someone to take your BP. In every corner, there is an area for BP taking. You just push your hand and text your BP, and you know your BP. So it is another word for taking sugars. You don't need even to prick yourself. You just put there the finger and text your what? Your sugar. So such telemedicine, if we also adapt it, then we would learn from them. How did they do it? How are they doing it? Then it will encourage us also to innovate in terms of what? Telemedicine. Networking. I tell you, all these people didn't know each other. So we have a platform globally, not just in Uganda, where we as alumni, KOFIH alumni, can go and meet and discuss on the health issues affecting our countries. So each one of us can have that opportunity to network, and it gives you a platform to speak. Maybe if I never went to Korea, I would not get this opportunity to speak here. But I've gotten this opportunity because of going to Korea. Now I have a platform. If I have anything, I can call on any of these alumni, and they will rescue me in 1 minute. So one of that is the networking, which it brings. Then, generally, collaborating and research provides data. These people do context-based research, which research generates data which is specific for managing hypertension and diabetes. So in fact, if we collaborated with them, their research is superb and well recognized, that if we also as learners or people who are in low and middle income countries learn how to use the research the way for them, they do the research and you implement the research you've done. In fact, all this, what we are doing here, is also research. It has data it generates, and that data, we can use it for managing hypertension and diabetes. In fact, SOHEC has already generated data, which we shall publish to make sure that we can use that. We shall never make this sweat go free. So generally, collaborating with the international countries would help us move a step ahead. Thank you.
Thank you so much, Atiang Elizabeth. Those are her full names. And yeah, I can see they have talked so many good things about South Korea, and I'm seeing some of you are wishing to migrate there. I could see the Holy Spirit was revealing these things to me somehow, especially people on this side. But you go there and the experience and come and build your country. Is that okay? Yeah, guys, let's not do brain drain. I could be in Europe. Why not? But I said, no, let me come here. Let me come and put a brick on the foundation of this country. Isn't it? Please, when you get a chance, go enjoy the summer and the winter, autumn, spring, come back. But now we have come to the end of the first session. I want to request the other alumni to come and we take a group photo. You are also very hungry. For sure. The oxygen data has been, by the way, fasting is good. The other thing they did tell you, the good health habit is the fasting. Intermittent fasting. So the longer you take on an empty stomach, unless you have health reasons, the better for you to prevent. That one we shall talk about it when you are going. But now, let me request, and Regina. Regina is also a grant winner. She won something on telehealth. Regina, you come and let me tell us quickly about your program. Let me recognize you first of all. Regina, come and introduce yourself. And the other room now, you come and we join the Magoba. Gloria, please come. We have someone from the office of the president. Beatrice, please. And please, your colleagues. Hashaka, you are the one blocking the way. Can you come? Yes, Hashaka. We want to take a group photo of the alumni. These people have traveled far to come and. Let me request also Emma. Emma Mugabe, please, from Kofi. Come and join this photo. Those who have advanced phones like Dominic, please help us also. We capture so that we have it in real time. And okay, so Regina, tell us quickly in 1 minute because people are very hungry. I am also suggesting instead of going out, they could bring so that we have working break. What do you think? Yes. Abraham, can you coordinate so that they serve starting from behind? Yes. Everyone gets a bite and a drink. So I think maybe you quickly introduce yourselves and it's all of these people are introduced, right? I think let's concentrate on the photo now, right? Yes, as the drinks come in. I don't want to be captured with this mic.
As the earlier mentioned. So this is more to do with emergency because normally when we have a health issue, we ask ourselves, where do we go? Where is this service being rendered? So this is a mobile app to link, like you have to log in and then you'll be able to know where and who is actually able to provide a certain particular activity in a health facility. So simply that is it. And I wish I was able to give you, maybe I'll share with someone. There's a link to that whereby you need to log in. It's a Google link. Then you'll be able to access the facilities, already linked to all the facilities in the country. So thank you so much. Yeah.
Thank you, Regina. Regina is an administrator. So the team that goes to is multidisciplinary. We have administrators and like Regina and Beatrice. They were in the, yes, the administrators, yes, those are the ones. Then we have epidemiologists. Am I not the only one? No? Hey, epidemiology. Oh, great, great. Then we have policy. Policy. Do we have anyone from policy? Policy. Who went for policy in South Korea? Yes. Gloria went for policy. We have care and treatment specialists. It is called which one now? Clinical experts. I was undervaluing. I'm sorry. Let me, let me bend the role as the culture demanding. I'm very sorry. My fault. So clinical experts, you stand up. I think you are quite a number. Yes, these are the clinical experts. She's doing pediatrics. He's a surgeon, orthopedic surgeon, by the way. General, I thought the bias was with the bias in orthopedics. That's what we call it. General with the bias in orthopedics. Yes, and okay, so that's about now. Let me request, I think we are going to have a few speeches. Please stay where you are. Your glucose will find you. Your energy will find you where you are. Yeah, maybe we should have started in the front. The hungrier faces are in the front. But as I told you, intermittent fasting is good. So when you feel hunger, sometimes that's your friend. Yes, so it helps you to, the insulin. Yes, that insulin they told you is also, when you eat, it comes out a lot, a lot. So the less you eat, the better, because you spare your insulin. Then it will not become deficient in the long run. You get? But when you eat too much sugars, it comes out a lot. Then you get insulin resistance. That is diabetes. Hey, by the way, am I talking? I have complicated the topic. Let's stay on awareness. The next speech is from the students' representative, Abraham. Wherever you are, is Abraham near? Hey, Abraham has really been coordinating. He's also the coordinator for this project. Please, if you need any coordination issues, Zohek has been helping us a lot. But on behalf of the students, One Health as well, you give your remarks and actually invite your patron. You have you will have the privilege and honor to invite your patron, Dr. Gad, give his good remarks after you. I think the tasks are clear, sir. Yes, sir.
Thank you so much, Dr. Mugisha. Our visitors and patron. It's not actually a patron, it's the advisor of the club. And then the club committee, the KOFIH alumni, and everyone. Thank you for coming. My name is Abraham, and on the Zohetic One Health Engagement and Communication, I do most of the coordination. By the way, the project is big. People think it's NCDs. No, we have a lot. We have over 5 objectives. And then you see that campaign is the last one. So we have other 4 things which are there. So the work is much, but I want to thank everyone for coming and joining this campaign. It has not been easy organizing and making sure that all things are in place. So for students who have joined, thank you so much. We have freshers, I think, year ones. Freshers, I'm stigmatizing you, sorry. Year ones, I want to see year ones. Do you have year ones here? Raise your hands. Yeah, thank you for coming, first years. I think these people should be linked to the One Health Club. I'm sure some of them haven't joined, but we want to welcome you. MAST is a very good community. We are going to learn a lot of things. I'm glad that you have joined when you were in first year. Other people have joined when they're in 4th year, 5th year, and as the person, finishes, is just trying to learn. But for you who have just joined when you were in year 1, you're not going to regret. It's going to build your career. It's going to give you connections. You still already have connections which are here. We have these big people. We have the doctors. We have some are professors. So thank you for joining. It's not going to be in vain. And please keep it up. So for this very project, for this very objective number 5 of raising awareness on diabetes and hypertension, I think we've taken the message. We're going to take message back to our neighbors, back to our friends. Things are on the YouTube, EYIT, and it's going to send us clips and every other thing. So you go and create more awareness, teach your friends, tell them that eating bread every day is not healthy. Yeah. You need to exercise. I think Hashaka has done most of the work. And for me, I just want to say thank you so much for coming. And please join us in other campaigns. If you are here, I want you to get your phone. Get your phone like this. We're just going to do a very simple exercise. Look, can you send, I don't know, we need, everyone I think should be having the link, live stream. I want us to tweet. I'm sure most of you have Twitter accounts. If you don't have, then move out. Yeah, so you get your phones. Look, I think you can circulate the message. You can circulate whatever you want us to tweet, and everyone at least, we are more than 100. If we make 100 tweets, we are going to reach a lot of people in and outside Uganda. So you can WhatsApp, create the status, then tweet. Life is going to be okay. Is it done? Look at your neighbor. Look at your neighbor. I hope it's done. So I want to thank the organizers. I want to thank KOFIH for giving us the funding. And I want to thank Dr. Mikisha specifically for writing with your team. You've really encouraged most of the people here to write, join you. And of course, by coming here, they're also learning. I'm not going to talk much or whatever, but I just want to say thank you. Thank you, Edgar. Edgar, you should stand up. People should clap for you. You stand up, Edgar. Edgar is the person behind whatever we are putting on, the designs, the capes, and everything. If you have your business, I think, Doctor, you need to. Edgar, thank you so much for partnering with SOHEC, and I think we are all smart, really. We are very smart. So I want to end by wishing you a Merry Christmas and Happy New Year. So I've been appointed to we want to first invite the KOFIH representative. You are needed to come and then the KGA representative, Dr. Mona, and Dr. Gad as well. You've been invited to come and take your seat from this side. So, in a few words, I want to take this honor to welcome Dr. Gad. Dr. Gad, you are welcome.
Orire muta egahe imucheyo bali zako. I think I should have I have enjoyed this morning's meeting. The level that I started reflecting on what I've read about Korea, and I could do error. So to cover all my errors, I would like to start my speech by saying what is commonly said: all protocol is observed. I would like to appreciate from deep down my heart Dr. Migisha Richard. Dr. Migisha Richard, it is true I know you from long ago, but those years when we are hosting global health students from the University of Lund, oftentimes, and you were so easy to get along with, and you'd mobilize students all the time, and your qualifications took you to the environs of a not very functional health facility which you made resurrect. I didn't know that you would reach this far, join us, really doing better than we can do, because a good teacher makes sure that the student does much better than them in inspiring the next generation of leaders. Please join me to thank Dr. Mugisha Richard. I have also been impressed deep from within my heart about the eloquence with which the panel explained clearly the notorious problems of diabetes, hypertension. I'd like also to applaud you for staying simple, easy to approach, demystifying science, vividly bringing your Korean experiences home, and really spelling out that it is possible for us to do something. We don't only congratulate you, we also thank you. Please, let's clap for them. My heart rejoices when I see that those who did what they could make one or two contributions in life did a great job. These thoughts take me to a common saying attributed to Sir Isaac Newton, or Jock, the father of physics, who competes with Albert Einstein in that title, when he said, "I have seen far, not because I'm tall, but because I stood on the shoulders of giants, and specifically now intellectuals." This afternoon similarly reminds me of the trouble that diabetes can bring, because a few years ago, not taken a lot of labor to remember, because he did the rituals required to say goodbye to us, of my brother, Reverend Sam Kitumachiza, who passed on due to diabetes. Commonly with diabetes, when one becomes a patient, slowly but with time and surely, they eventually become a student of their illness. They can tell you, "I am sensing that my body has changed, I need to do something." They can even tell you, "This feels like hypoglycemia, this feels like hyperglycemia, a lot of sugar, less sugar in blood, I feel dizzy." Those things happen. As he was approaching his 20th year, he started reading widely about his disease. Okay, the disease is diabetes, which had become his disease, and he started the journey of the farewells. Because it is said that with adult onset diabetes, 20th year, there is a tendency, if it's not controlled well, for it to become notorious. I was anxious myself that would end up by having, they sometimes appear like triplets, especially towards death. When you hear the person is hypertensive, then diabetic, then later on kidney disease. The man was a man of God, so I guess God took him at the right time before the triplet disease descended upon him. May his soul rest in eternal peace, and other people who have gone the same way. Yes, we can do something. Also, today reminds me when I was a little lad, this hospital, when we started the class for students of diabetes and hypertension, and we used to call them special clinics. When I also came here to Mbarara University, I worked for a year in the outpatients department. It was very much the same. But as those from Korea remarked, it was so much disorganized. Colleagues, friends, younger people here, there is hope. There is hope we had come at a time when many of us were starting to despair, because you could hear stories, a narrative of a dilapidated healthcare system. A dilapidated health. How do you ask a patient who is bleeding, give me some money first, then I'll tend to you? How does one how does one do that when they have been called to become a healthcare provider? Today also marks a turning point. And today also marks a day when I've been reading over this last week the philosophy of revolutions, at least for the information of doctoral students. And the revolutions, how I have read and understood them, is that commonly they are only perceived to be political. So you have Napoleon's revolution, you have French Revolution, you have President Museveni's NRM revolution, but also, most importantly, they are knowledge revolutions. When there is a shift in the understanding and practice of a people, when people realize they can do something and something quite quickly, when people cease to point fingers at others, and they do something relentlessly, with commitment, with passion, because then they realize that's what every human being needs to do. In fact, oftentimes it is safer to imagine that every nation worth the name has experienced a type of revolution. The lingering issue is what type of revolution. The story of South Korea is very alarming to us as Ugandans, because at independent Uganda in 1962, the GDP was the same, the context, the situations, the dilemmas were the same. I tried to read deeper in my geography, and now, by the way, I'm widely traveled. I've been convinced people that I don't need to travel. But this talk has aroused my interest to think again about the possibility to travel one day to Singapore and maybe to South Korea, and why not possibly to North Korea as well, where nuclear weaponry has threatened and frightened everyone on earth. So, but there was a revolution in the thinking of the people that we can do something and we can do it and we can teach others. I salute the Korea Foundation for International Healthcare, KOFIH. Are you hearing the word KOFIH? Uganda's coffee is for export. But this coffee that South Korea has exported to us is good news. And please mark that it is international. Here I'm asking myself, what will Ugandans export to others? I also would like to stand here to assure you and raise anxiety, especially to those who are preachers of doom. We always remark, we the patriots of Uganda, that we belong to once upon a time sleeping giant Africa, now rising unstoppably. And please make no mistake, it's about you. It's about you can do something. Number of us belong to families, you know, there are people who call me Jaja Boy. For me, when I start the language of Jaja Boy, grandfather, grandmother, I easily talk about the people who put on the first clothing, the people who use the first, properly made beds. I talk about the people who first attempted to visit hospital. The people who first, I have an aunt, she's 93. She has, I think, never visited any hospital. She's part of the natural ecosystem, 93. They are close to Motori Hospital. She has never entered any car. But magically, the rest of the people left her, she's alive. Some of these things by them must be researched. And I also am so pleased about Southern Korea. Thanks be to Uganda, a non-aligned country. When Trump becomes president, we shake hands, we say you are our friend. As long as he is also thinking about our interests. When the European Union says there is something we can work together, if our needs are being addressed, we say you are our friends. But more recently, our friendship with the Asian tigers is more than vivid. We thank them. Thank them, they are our friends. The oldest surviving railway in East Africa, Tazam Railway, was built by the Asian countries. It seems sometimes a number of people just give us lip service. I'd like to thank the Patriots of Africa, here present, the KOFIH alumni, for having taken a leap to go to that far-off country. A place called home cannot be far, because you have something in common to bring good news to us. Many Ugandans travel, they go, when they are making resolutions, I should have said Africa, because now Uganda, by the way, is now being looked at as an example of success. So at the time of resolutions, when they are writing, we agree today to do the following. It used to be common that Africans would go for shopping. You didn't do that. You've become like the African hunter. You've become an emissary. President Museveni, when was Chancellor, the presidents used to be chancellors when the universities were still few. He would say you are an emissary. An emissary is someone who goes out, looks for something nice, hunts, looks out for the best ideas, and copies and brings back home. I'm amazed that also South Korea appears to have challenged China, because China in literature has been claiming that they cut short their development time by 10 years. But for Southern Korea, we've heard it is 20 years. Yes, it is possible. I've also seen for myself here how a country that was once led by a P4 River, President Idi Amin, is now having an array of PhD holders, not only in our universities, but also in the cabinet at policy levels. You heard the type of music here when people are explaining disease, ill health, without, reading from the script. This is good news. So we will more than challenge the prophets of doom. Africa, yes, Africa is unstoppable. And at that, Uganda. I have also taken time to reflect on what these diseases mean in terms of prevention. Make no mistake, most of the diseases are preventable, if not all, through proper habits, and usually eating habits, sleeping habits, exercise habits. Yes, Korea passes 100%. They are sometimes called diseases of lifestyle. Diseases of lifestyle. And if you want to pass subjects such as public health with a distinction, you have to read, for example, the social determinants of disease. That is why possibly my she's a type of grandmother, 93, I think 94 there, because she has lived a social life that is enabling her eating. Love eating vegetables. More vegetables, more than meat. Love exercising. Don't live sedentary life. Time yourself, the time you take on a computer. And actually, also, I'd like to congratulate and thank the project leaders for having intervened in urban health. Because commonly, when we are programming, we forget the urban communities who are in many ways left out in all programming. You don't have to do a big experiment to know how difficult it is to manage urban health. All you have to do is to contact tracing of a TB patient. It becomes very hard. The patient you have diagnosed in the morning, by evening time will be in the city of Mbarara, by evening time could be in the city of Mbari and even beyond. And this makes urban health difficult to program. So most of the things are preventable: diabetes, hypertension, and others. I love the way you were illustrating using easy examples. Check regularly. Yes, check regularly. I have been also advised by Comrade Dr. Migisha to talk about the concept of universal health coverage or primary health care. I was a young lad in Kisi's hospital when it didn't make meaning to me that the more time I took to see patients, the more the line seemed to grow longer. So I made a rare decision and absconded the hospital to go and take a master's in education for primary health care in Manchester Victorian University in 1996. And there have not been any regrets. That's the time when Mbarara University was simmering with its community-based education program. I also made at the same time a decision that I would try to do everything possible to enter this university. I came just with a little message that primary health care is possible. That it is possible to make owners doing their own things contribute to their own health. That it is possible for families to adopt healthcare lifestyles. Later on, I have met some of the most wonderful Ugandans, such as Professor Mwaswa, who usually says, and I quote, "Health is made at home and repaired in hospitals when it gets broken down." I later on met other leaders, such as Professor Kayanza, who believed that I meant well. And I don't know, maybe I could pay for someone's membership, but these are younger children. There might not, unless they are doing a master's degree. Someone who is 24, someone who is 23. There's someone who is 23 or 24. We need to do some business in one head. Pardon? Someone there, huh? That person if he's not a member of One Health, we will discuss that. Me and you will discuss that. So that I can join One Health. So when I joined, I didn't look back. I'm also grateful to God that the simmering steps that I made have more than made Mbarara University present in the communities where our graduates have been. Where they have. When Mbarara University started, it was very difficult to find a health worker at a place such as Bugizugera Health Center 4. There are some places which didn't have any modern health care to talk about, such as Bugindi Community Hospital. But a few things have improved. Yes, it is possible. I'd like to emphasize the three things. First of all, I think this universal health coverage, it's not complete. That it is possible. It is possible that wherever people are, health messages are talked about. The way in the Kafundas, people talk about sex, isn't it? People talk about sex. People talk about football, of course. Yes, they do. People talk about their religious orientation. People talk about who is greater than the other. It is possible to talk about our health wherever people are. And this is where the concept of universal health coverage comes in. When it became turbulent that people are suspecting that Mbarara University Community Program was not having an impact, I also deliberately chose to study for my PhD on the topic community-based education and equitable delivery of health services in Uganda, the case of Mbarara University of Science and Technology. I discovered that by having a community-based education model, Mbarara University's model substantially contributes to the accessibility, acceptability, and affordability of health services. And above, I have given one or two examples. So it's the way to go. The importance of One Health also needs to be emphasized. The concept of One Health was introduced to me by similar, very nice, excellent people, mentors, such as Professor William Wazeyo, Professor David Kabasa, and another time celebrated Professor Nelson Sewankambo, who taught me the ways of service beyond self. Yes, it is very important to learn together, to be able to work together. And this is the very root of collaboration. It used to even to be emphasized that publish or perish, but today it is even much more emphasized that network or disappear. There is no problem, however small currently, that can be solved by an individual working alone. This is why I'm also pleased that we are able to spend this weekend like this. Because many people are still doing the other things that I've talked about above. And they don't usually cause a lot of change. Yes, we are in the current era, second emphasis of endemic. There are diseases we are used to. But these diseases we are used to, unfortunately, AIDS is also joining. HIV is joining. You younger people, listen to be able to stay alive. When we listen to Professor Kayanja and others, we were able to either modulate ourselves or to stop illicit sex, and as a result, we are alive. So, importance of listening. This current era of endemic diseases, those are diseases with us, the usual diarrhea, the usual cough, the usual heart. Emerging diseases, they are diseases that we had never heard of. There is a professor, I hope I remember his name shortly. He informed us that COVID is one of the earliest visitors to the human race. A group of COVID viruses, there are others out there. So we need to be vigilant because of these emerging diseases, as well as re-emerging health problems and diseases. There are those problems which had gone. By the way, these days I get surprised. I'm glad there is none of you that is a culprit. In walking a long journey, what, but the air we are breathing is very sane. These days I'm surprised. Bathing, senior 6, senior 4. For lack of a better word, because of politeness, I'm talking about boys. I think it would be easier because I look like a boy. To find bathing, stopping bathing, that it's a lifestyle. That it's now a modern lifestyle. As a result, then, we will get a problem. Lice will come back, fleas will come back, jiggers will come back. Those are the emerging diseases. They can be solved still collaboratively. There are other diseases of drugs. I visited downtown Mombasa. What I saw made me scared. I have a prediction that the drugs journey, the drugs are meaning marijuana and others, there is downtown Mombasa where you can't visit by 10 a.m. without an escort. Otherwise, they'll mug you. The half-mad people because of drugs will mug you. And it seems they are following the Trans-Africa Highway. The problem is following the Trans-Africa Highway the way it was for HIV/AIDS. So these emerging problems also require collaborative effort through One Health and wherever people are. Yes, we shall use all means. We shall use all means. Thank you very much. There is a friend. She is part of the Directorate of Disease Prevention, or is it a department? They have mobile clinical services. Recently, they invited us that we can collaborate together to enhance that. Mobile clinical services, a truck that is moving like a clinic. I was pledging that rather than our students learning in a class, they are an easy, hands-on health workforce. By the way, this problem of internship, I think the president is waiting for an answer. Because the problem is created by the schools, then it is handed over to a president whose background is not medicine. I think that's unfair. I think he needs an answer from us ourselves. And I can see that some of the answers reside in a country called Korea. I think the person who advise him will earn accolades. And you know how old people give presents. I think someone can win a big present through that. So yes, we shall always use all means, including medical camps and others. Yes, the case of South Korea is a success. As a doctoral student, one time of higher education, I was taught how South Korea, three countries, South Korea, the country called Indiana State in the US, and also Finland, are case studies of success of how universities can work together, collaborate with the community to uplift healthcare. In all my writings, I have shown how also Mbarara University is taking steps, the right steps, in showing the way on how the healthcare workforce can be educated through solidarity approach. The Chinese, the Cuban model of educating health scientists, they educate like you. I saw you were teaching. They don't complicate things. They easy things because health is health. In fact, you asked a very good question. Supposing the health sciences were being taught in vernacular, what type of languages would be used, or we be using? And of course, it is possible. So yes, I join you to welcome you about this signature moment that we are witnessing today. It is my considered opinion that whereas Professor Kayanja at Mbarara University helped to start a unique institution, Professor Celestino Obua taught to restart research in new ways, and the current Vice Chancellor, Professor Pauline Jachika, is a young dynamic leader. At that, she's a mother. She's not a frightening person. Me and my comrade friend Richard can talk to her. At an appropriate time, it is our duty to invite her to join this celebration again. I take this to be a major launch, a signature moment, the beginning of a health revolution in Uganda. It's my considered opinion that as the fruits continue to gather to fall, that we'll invite other people, including our dear Vice Chancellor, Professor Pauline Jachika, to celebrate the success we are witnessing today. For God and my country, succeed we must.
Thank you very much, Gad, for your keynote address. I want us to actually stand up and give that hand clap when we are standing up for sure. Yes. Thank you. That is the standing ovation. Yes, you have spoken very well, and thank you for even inspiring. Your words have really inspired us. And the next on our agenda, we are, and thank you, Abraham, for talking also about the ZOEC project. I think let me do the duties of the activities of ZOEC project. I'm orienting now the new people here. What we have so far we are working on today is the fifth activity, which is implementing an awareness campaign about diabetes and hypertension. But we are also assessing knowledge and attitudes of healthcare on priority zoonotic diseases, anthrax, rabies, Crimean Congo hemorrhagic fever, Rift Valley fever. Those are diseases, okay? So next time we shall invite you here for dissemination. The next event we shall invite you for will be dissemination. Those of you now that you are online, please you follow us. We have a Twitter account. Have you followed us? Yes. Rook, you come and tell us about this Twitter handle. There is a way handles disturb me. Is Rook here? Who is handling the? Yes. I can once tell them about how to follow us also. You know, these days, if you are not also online, you will be extinct. Yes, that is a fact. I think take us through so that people follow us, and when we pass the invite, they can also access it. Yes.
Good afternoon to us. We have social media accounts, and one of them is Twitter or X. I think I've been sharing links in the groups. So when you follow those links, they will lead you to the activities that we are posting there right now. So on our X, it is ZOHEC 2425. So you can go there right now. You follow us, you repost, you like, and when you post these photos that we are taking here, you can tag us, and we are going to come and we are going to repost every activity that you post and you tag us. So when you follow those accounts, you will be following the activities that they are going, as we are doing, even the community activities that we've been doing, what we are going to do. So you will keep updated in that you can easily join in and you know, these are good activities for the community that you need to engage in. So thank you. ZOHEC 2425 for X. Thank you so much.
Yes. Thank you, Nikolai. Kamsamda. So now the first one is awareness priorities zoonotic diseases. Then we realized there are gaps. These zoonotic diseases are diseases which pass from animals to humans. Now there were gaps in detection. You find they are detecting people when already they are bleeding. Some of them are hemorrhagic fevers. They bleed before the patients die. So that's when they realize, someone is bleeding. The antimalarials didn't work even if the blood slide was negative. These days the clinician, even when they don't find the blood slide is negative, they don't believe the clinical malaria. Let's just treat. Then everything refuses until the patient is about to die. Then they realize, by the way, maybe they call a consultant. And then it is the consultant to save infectious diseases. You might be dealing with Ebola. You know, it was here last, you remember? It was here, 9 districts affected. So now, the detection has been late. And one of the gaps has been that the frontline health workers, they are not aware about the signs and symptoms and how to detect. So we are now developing a zoonotic diseases prevention training manual for healthcare workers. So it's one of our activities. And then we'll train the healthcare workers on how these zoonotic diseases. And One Health, Dr. Gad talked about One Health. It's about multidisciplinarity, multi-sectoral approach. So now there is another, we are establishing a technical One Health working group. A group that can actually talk about the policies for One Health. What can we do? Because these diseases cross from animals. The diseases, the animals are dying, vets are not telling you are also managing. Until people, now there is anthrax in Zimbabwe, 3 people have died. This is life. 3 people have died. Now, the animals are dying, the vets keep quiet. The human is contract, and now, so there is that, we need to come together. So that's why we are forming this technical working group for One Health and establishing it at the Mbarara Emergency Operations Center. And that group will come up with the regional One Health mitigation plan. So it's another activity. let's not only be reactive. We wait until people die, and then we come reacting. Oh, no. Now we are saying let's prevent. We need a plan to prevent these diseases. Let's get a plan in the region. And we are using southwestern Uganda as a pilot. If this works, Emma Kofi will have to give me more money. Okay, we are many. I'm talking on behalf. Kofi will give us more money and we extend. He's also worked, he wants more money, but there is enough. Yes, so anyway, this is something we are piloting in southwestern Uganda. Now, I just wanted to tell you about the ZOHEC project, and that's the end of my speech. You don't have to clap for me, but you clap also now. Oh, that warms my heart. Yes, that warms my heart. So now, the next is, this is an alumni activity, KOFIH Global Alumni. And we have a representative, alumni. You have stood up a lot, but it's also good exercise for you. You stand up again. Because now, yes, Gloria, yes. Yes. So these are the ones who have come from very far to come, and let's clap for them again. And I want to invite Dr. Omona to, talk on behalf of the alumni and actually invite the KOFIH representative who will give us, you have to close this. We started it. With your indulgence, we opened this, but now you have to close it with your remarks. So at the end of your speech, but we need to close, we started with a prayer, isn't it? They say good things happen when God mixes with. If you knew that song, I would sing it. But I forgot I don't remember the chorus, I forgot the stanza. So anyway, let Dr. Mona take charge and invite Emma then to...
Thank you very much. I've already introduced myself. I'm Dr. Mona Alphonse. I'm a member of from Africa and Asia. And their main focus is in healthcare. So for them, they support government projects, government activities. That is why you see that all the KOFIH alumni are mainly people working within the health sector. Like for me, I work at Masaka Regional Referral Hospital. She's at Kabal Regional Referral Hospital, and the others from different hospitals across the country. Now, KOFIH, through the Lee Jong-hook Memorial Fund, supports healthcare workers in capacity development. So what we do is, KOFIH helps to take you to Korea so that you learn something new, something different within the health system. Health system strengthening in different fields, like clinical experts, like you have seen the people of the clinical experts. And then within the clinical experts, there are emergency medical services, there's the oncology, there's infectious disease, and many others. And also there is biomedical engineering. Now, when you go and train, then you come back to where you are working, and then you can apply some of the new things you have got. Like for us, we saw that there was a gap in training trauma care in Uganda. So when we went there, we learned about it, and when we came back, we developed ours, and now it is working in select hospitals. So like for her, she developed a mobile app which helped people to link up to the hospitals. And there are many others. So ZOHEC is just one of them. Now, everybody who went to Korea under KOFIH are now back, and we are a total of around 136. So we came up together as alumni called the KOFIH Global Alumni Ugandan Chapter. And then we have formed a group, and our president, unfortunately, is not able to make it with us today. The same as the vice president, who has traveled abroad. And Dr. Migisha is actually the advisor. Okay? We have Regina. She is the treasurer. Ashaka is the general secretary. Ashaka, where are you? Okay, Ashaka is the General Secretary. I am the person in charge of scientific committee. Now, the scientific committee is what approves the project like ZOHEC. So in case you become an alumni and you are writing some project, your project comes to the scientific committee and we look through it, innovate it, makes it better, makes it align with the government policies, government programs, and then it will be forwarded for funding. So this is just one of the many activities that we as the KGA, Korean Global Coffee Global Alumni, continue to do in the country. And remember, this is not, or if I can say, coffee is not like an NGO. They don't work like NGOs where they come do their things and they go away. Coffee support government activities. So this is actually an activity of the Ministry of Health. It is not something which will die out. It is something that will continue and will continue forever. Solving our local problems with our local skills and local resources. At this point, I thank you so much. Let me invite the coffee representative.
Thank you so much, Dr. Mona. Allow me read on the previously announced the previously announced agenda guidelines or what? You had an agenda for today's meeting? Okay. Dear ladies and gentlemen gathered here, Dr. Mijisha, thank you so much for being the main convener of this meeting. My name is Mugabe Emmanuel. I work as the project coordinator for the Korea Foundation for International Health Care. I sit at Masaka Referral Hospital. However, today I came to represent the country representative. That's Mr. Don Kim, who is not around today because actually he's handling some other assignments, and that's why I came here today. I'll be so brief to start with, as earlier on said by Dr. Mona, COP is not an NGO, but a government agency. And the good news I want to bring to you today is that as of now, COP is now a diplomatic mission. It joins organizations like the WHO and the US Embassy. We attained that kind of commemoration from the Uganda government. COP focuses so much on health care development for developing countries. And I understand Uganda is one of the developing countries. A lot has been covered under coffee. We have several projects across the globe in Africa and Asia. And for Africa, we have projects in Uganda, Ethiopia, Tanzania, Ghana. Then in Asia, we have some projects in Sri Lanka, Cambodia, and several other countries. Now, the One Health approach, to me, I believe One Health contributes to health for all. And the time is now for us to build our country's health care, because actually the health care of the country begins with us. Choosing the southwestern region for zoonotic diseases, I think, was a much more better idea, this being a cattle corridor. But our main emphasis today lies under the NCDs. I hope, Doctor, today you didn't contribute to the NCDs because from the presentations given by the members here, you talked about the lipids, the fatty oils, the sodas, but I can see that's what we... But anyway, I think we shall have to break it down as we walk. But I want to thank everyone for the walk. It was a walk to help and create awareness for everyone around our communities. COFIH still commits to supporting several projects that always want to come up, and there's the COFIH Korea Global Alumni. It has the body, and there's a Secretary General here. Where is Hashaka? I saw him coming in. You can please approach him. Those who have other projects, please, you can liaise with them. They can actually give you guidance, because COFIH commits to that. Then the issue of zoonotic diseases from your presentation, Doctor. I think it's high time now that we brought on board the vets or the people from the Ministry of Agriculture. because we can't continue to work in silos. We now need to work in synergies, because for several years, my question has never been answered. Why is it anthrax normally comes during the festive seasons? That's a question that leaves a lot of gaps. So I think it's high time we brought on board these people. Maybe these farmers in the villages there are not actually following the IPC of animal husbandry. So I think we need to bring them on board for the next other engagements. I don't think I should talk much. Allow me stop here and wish you journey masses back home to those who came from away from Mbarara. And for the mass students who are here under the SOHEC fraternity, thank you so much for such a kind of initiative. And please, Doctor, you can continue guiding them through Dr. Gad, and maybe several projects can also still come up and also be sponsored. Thank you so much.
Thank you so much, Emma, for your kind words. And as you realize, there are opportunities here. Dr. Gad, you know, I think there are many projects on the table. KOFIH now, the status where they have reached, the door is more open now and bigger. So let's continue synergizing, and because it's working together that we can achieve a lot. And I think, ladies and gentlemen, we are coming to the climax of today's event. Did we have any questions, by the way? We didn't actually. We forgot to open it up, but we have Twitter. Can you post your question there? Yes, this is one reason why we need. Can you post your comment and question there? And then we can actually. But let me hand over to. Yes, let's have like 2 or 3, some on Twitter, others now. Let me see where the question is. Yes, Andrew. The Holy Spirit tells me that's your name. If you are not Andrew, you say otherwise. Yeah, Andrew, it can also be a comment, okay?
Thank you very much, ZOHEC team. I'm called Andrew Tumwine. I'm a student, Master of Science in Nursing, Pediatrics. I wish to get clear from Dr. Omona. He said for the scientific committee, if someone is right, has to be an alumni, and if you have something to write about ZOHEC and all the NCDs, whatever, and it's so interesting, he has to pass through and then credit it, and then you proceed. Assuming you are not an alumni, but you are part of the ZOHEC like we are now, is it possible to write and then get that chance for your scientific review? Thank you very much.
Okay, thank you very much, Andrew, for, I think Omona has captured that one. Any other? Yes. Let me see this name. By the time I reach there, will it have come? Ahabge, yes. This is Ahabge.
Good afternoon, everyone. As Dr. Migisha introduced me, I'm Ahabge botanically. I'm a master student of physiology in Mbarara University of Science and Technology. I've seen with non-communicable diseases, the one way of eliminating them is multi-sector approach. We work as a team. You realize, of recent, we are being treated by health workers, which doesn't pay attention to nutrition industry. And we are fed up by nutrition industry, which doesn't pay attention to health. Remember, I was reading in a paper when ND was saying people are giving ARVs to pigs and chicken. And along the way, it has an effect in either way. Plants, animals, and human beings, as we all termed as one health. Now, what we need to do, my input would be, can we bring all people, the stakeholders on board, the policymakers, the rural community, the business people? For example, if you look at the UNBS, You heard of the outcry of people complaining, Dr. Gad, you know what is available in Western Uganda. If you bring something that gives manpower, even if you lie, everybody would buy. And that is because of poor nutrition. You say Embogo, Entare, you say Chituzi, and everybody would buy in an attempt of manpower. So we need to bring, what is the role of UNBS? What is the role of the parliament? What is the role of agriculture? What is the role of the executive? Then we go back to hire the legislature, the executive, and the judiciary. But if we are to stand as health people, it will end in tears. Number two, me, I have a rich background. I'm an agricultural person. I did a diploma in agriculture. Background is I'm a nurse. I joined the military. So you realize if you look at those, so you realize if these are the people, you cannot spend a year, I can bet my head, without seeing a general dying of hypertension, diabetes, and very many issues. So we need to bring, this one should not even be Mbarara, it should be national. Otherwise we shall keep here putting, I'm telling you, if you make sampling in Mbarara, out of 10 men, 7 are now on Cindy Kanyake as people call it in. They no longer stand for themselves as men. So, Dr. Migisha, our beloved innovator for this here, I wish it can be re-energized. Number two, we should use the power of mass media. The challenge with us here in Uganda is media is state-owned. There are things which cannot move out. If you go to Chiruhura now, people are using herbicides for killing antimicrobial resistance. They are using dudu. Their cows have lost eyes completely. And let me tell you, they say for milk you should take 3 days. Oh, withdrawal period, there is always withdrawal period. But after they have injected the animals, vaccinated, now they bring milk to dairy. Who take the milk? Us. Now we are subjecting our bodies to antibiotics when you're not yet sick. Then when you get, they give you antibiotics and you're not responding, you die. And Africans believe God has called you. No. So we need, number one, to educate the veterinary people. We need to bring the lawyers, the business people, the parliament, and everyone. And I'm telling you, we shall achieve what Dr. Gad and Dr. Migisha are saying as one. Thank you so much.
Thank you very much, Habgen Newton. And Habgen Newton, for your information, you can see for him is in a clinical gear. He's the one who was walking behind. Should anyone faint in the walk? First aid team, let's again clap for him for that selfless service. And yeah, I think he has given very good comments. He has requested me, but I am also requesting, I think this request, KOFIH is the one who can, what they are doing is actually what they are trying to help us achieve. He's requesting for bigger scale up to have more impact and more multidisciplinary inclusion. I think we will get there with the supporting partners like KOFIH and others. For me, I think, and thank you for bringing the realities. And I am inviting you on the dissemination. I think you need to give an opening remarks on the dissemination for the ZOHEC project. So officially, we are enrolling him into one with Dr. Gad. Yes, this is. You have received the baptism. This I don't know if it is by water or by fire. Both by water and fire. Good. So now, yes, my role to baptize. So now, next comment. Did we say we are taking? There was another hand. Good. I think should let any other hand. I want to first see the hand so that we cross the others be on Twitter. Aha, it's the last hand I think.
Good afternoon, everyone. Yeah, like my question is, my name is Talima Ignatius. I'm a second year student of medicine and surgery. I was like, in case you're an undergraduate student and you have a research project, maybe you want to come up with one. Is coffee able to maybe help you out somehow? Like you have seen, many of us here, we are undergraduates. Like, we would also want to take part in it. Thank you.
This man is robbing. We call it robbing. His question is a robbing one. Can coffee support? How do we to funirawa? Yes. To funirawa is how do we? I think that question will go to you, Emma. You can, but it is what does coffee support in that regard of these communities? Okay, but the gender has not been balanced. Then you remember when they were going in the sea, when they didn't balance the boat. What happened? Let's balance the boat. So one has also gender, there are gender considerations, and it is never complete. So we demand that the ladies ask questions. If not all comment, let me go actually this one. Can you say something? At least introduce yourself and say some. Tell us who you are. Say something. Yes.
Good afternoon, everyone. Nakalio Alice, pharmacy student. I have no questions. I'm happy to be here.
Let's go for her. She's happy to be here. Very good comment. So, any lady with a question? Comment? Katushabe, yes. This lady is called Katushabe.
Thank you very much. I'm called Katushabe. I work with Mbarara Regional Referral Hospital, and I'm happy to be part of ZOHEC project or campaign. I would like to give a credit to this project because, like in our hospital, when I'm on ward, I would find many patients, they come with complications of diabetes and then hypertension. And most of them, they come with hemorrhagic strokes, ischemic strokes. And I work in ICU, and recently we had like 4 patients. They came with some with subarachnoid hemorrhage, and the cause is poorly controlled hypertension. So in my mind, I was always asking myself that should be done out there. And I'm like, because most people, they come to the hospital when they have complications. And it is okay. You try to tell them, like you tell the relatives what happened and what should be done. For them, they look at it as if it is, So when I saw this awareness, like I was seeing them on Twitter and the X, that they went to the community and you are trying to give the health education talks. I was really very happy, and I was like, because I'm busy, but I wish I was part of you, maybe to tell them what happens in the hospital. So thank you so much. Whoever started this, may God bless you. And then I have seen people introducing themselves as alumni of from Mulago, from Masaka. Last year I was doing my research about TBI, and I went to Masaka to do my pilot from there at emergency unit. And I found their emergency was well organized, well set, and then my participants were health workers, and my questionnaire, I was doing a questionnaire, and then at the same time I was observing their practices in emergency management of TBI, patients with traumatic brain injury. So I saw the way how they were doing their things. It was perfect. When I tried to ask, people were telling me that they have a team which has gone to Korea, and but um, just this is a request that you should also come to us at Mbarara Regional Referral Hospital. You try also to. I would like to see also alumni from Mbarara Regional Referral Hospital. Maybe it will help us also to organize our emergency well and also to give quality care for those emergencies. Mostly the traumatic brain injury patients, because we have accidents, which is also part of the non-communicable diseases. So thank you so much.
Thank you so much, Katushabe. A very for you, Dr. Mona is the head of the Department of Emergency that you are talking nice things about. So you can imagine what he's feeling. And also KOFIH. KOFIH has been supporting emergency medical services in the Masaka region. So also this is, I think, a very good evaluation of the project for sure. The testimonies are there. And of course, I think KOFIH will scale up, I'm sure, too. They have different things they support in. I think in Mbarara, they are currently supporting the cancer, NCDs cancer, right? We have someone from Cancer Institute registered there. Cancer, that is Ishimwe Diane. Yes, KOFIH has been supporting cancer. I think, yeah, she's here representing also from the Cancer Institute. Diana, you great people, and appreciate KOFIH, I think, for supporting you. People are about to take away the services from cancer to emergency. So KOFIH is supporting NCDs actually here. That's why even when we are doing One Health, they said you need to nest in the non-communicable disease objective for them to justify, coming this side as well. So that's how we came. So Ishimwe Diana, you greet people, introduce yourself and talk about what you do in your cancer, whatever, in 1 minute.
Thank you. Thank you so much. Thank you, Dr. Migisha. Thank you, KOFIH. We have heard you're the guys with the money. We appreciate for your services that you've extended them into the southern part of Uganda and specifically in Mbarara. I was not aware about you supporting the cancer services, but with us, with the cancer registry, we shall give you the statistics of the cancers in this region, and we shall be happy to work with you. And thank you so much.
Thank you. So for her, she's in records. She doesn't know what is happening at that top level where support is coming from. That's it. Thank you. I think let's give, there were 2 questions. One was to Mona. Let me have a comment from Dr. Gad, because some of the comments were cross-cutting from his speech as well. I think let's start with Dr. Gad, then to Mona and Emma, and then the pastor for today is who? Is still Joseph? We need the lady to close. There is a lady there. Yes. Yes, there is a lady there who will close for us. Over to you.
I am aroused to speak by the second year medical student. And it also reminds me of the debate I had one of when he remarked that was already a deputy head teacher in his 27. It also reminded me that I started work when I was very little. I don't know whether I was 19 or 18, but I was even teaching classmates in secondary school. Then also after senior 6, I taught. You can see that that helped me to gain confidence. I don't fear people. in many ways, I don't fear people. I think people are people. And whatever any other human being can do, I can also do, as long as I have the right attitude and I plan well. So the medical student in second year, you are a very, very brilliant person. And not that the others are not brilliant, you just came out to represent the rest. If you read the medical books, including the old Davidson Principles and Practice of Medicine, you will find that the best discoveries were made actually by medical students. And you will also find out that those of us who moved on at a snail's pace. So for example, when I came to Mbarara, there were very few masters. I had to hide that I had a master's to get a job in Mbarara. I had to hide my master's to get a job in Mbarara. And when I released it, I got a good job. Then more recently, when I have a master's, when they were looking for people to teach philosophy, they are basically not there. Haven't you heard that I'm preparing to teach philosophy? And okay, we get tired sometimes, but when I shave, you stand. When I'm going to shave my hair, you stand. When I shave my hair and I apply very, very good Vaseline, in the afternoon we will compete on a photo contest. So these words are very brilliant. Preserve your lives, but start early. Time is a non-renewable resource. It does not hurt for you to become a great person at 15. If you are on LinkedIn, you will see people who are doctors at 19. These days there is something called the accelerated education, where they equate you, and so by 19, I was struggling asking myself, this doctor, really in 18, 19, some of the issues you could see the marginal behaviors of a child, but the doctor was actually a doctor and qualified and about to start her master's. In Rwanda there, it is very easy to, people there, also when you Google, in South Africa and in Nigeria, there are so many case studies of people who are highly successful in their early 20s. Having a PhD at 24 is very nice, very nice. And actually I hope Vicky will not be offended. When we were talking, I was thinking about a PhD student. For me, wherever I go, I look for low-hanging fruits. And if my height allows me, I pick them. So I'm waiting for you in the PhD class. And so the student's question is a question for us Africans. When I went to study from Manchester Victorian University, the average life expectancy of Ugandan was 37. 37 years life expectancy at the age, as compared to Japan that time at 87. Currently, it staggers around 63. But anyway, after the 50th birthday, and you are careful of bad behavior, you are careful of drugs, you are careful of lifestyle, you do exercise, you make your choices carefully, you respect God, it is supposed to be that a decent person dies around or at least after 70. So start early. At 25, you'll be in the Guinness Book of Records. You'll be a great person. The name will be yours. The name will be for the country. The name will be for the village where you are born. Make Uganda great. Thank you.
Thank you. I think there are maybe two questions which I can respond at the same time. The lady, I forgot her name. Yes, Katshabe, who went to Masaka. Thank you so much for your observation, and we hope that we can be better. Just to let you know that Masaka region was being supported by KOFIH in the implementation of the EMS project, the very first of its kind in the country. And briefly, at the end of the project, the pilot project, they saved the lives of around 170,000 people and reduced mortality due to emergencies by 50%. So that's just a tip of the bigger activity that has been happening there. And we hope that we can expand across the country. Now, for the one who wants to do research, now this kind of activity is supported by KOFIH, but it has several components. Now, if you look at this assessment is like a research, okay? So we do not only just want to do research to improve knowledge and provide additional information. Within that same research, you can still offer services. So that's why you see, I think number 5 is offering service for people to benefit, okay? And then there's the aspect of training. So when you see these key project activities, you'll find there's research, there's training, and then there's service delivery. Now, if you are a student, the best thing you can do is to link up with any of the alumni. And this is one of the forums through which we can do those networking. So for you, you already know the people you should connect to. So if you have any idea, write it up and then link up with one of the alumni, because there's that aspect of sharing experience. Okay? For example, for us, when we went there in the emergency department, we saw how they treat patients there. There are so many health workers doing everything, like so many. So for us, we sat down and we're like, okay, these ones, there are so many. How about us? Are we so many? No, we are not many. At any one time, you might only find like 2 or 3 staff in the emergency department. So now what should we do? So we develop our training to fit into 3 people. So that experience sharing is what the alumni will help you to bring it within your project. So don't be afraid, your project and share it with one of the alumni, and then it will be looked into. Thank you.
The question from the other gentleman, my young brother, and the comment from Dr. Gad just reminded me of one training instructor at the Karama School of Warfare. He used to have a common saying in Swahili which used to go like this: muda ya mwanafunzi kufanya makosa ndiyo kama anafanya kosi, lakini akimalizia na kosi haruhusiwi kufanya makosa tena. Meaning that the time of someone to do mistakes is when you're in school. You do the mistakes, you try to polish them, you polish them, then you qualify. So the moment you qualify, you're not allowed to do any mistake. And now that one now counts to the comment of Dr. Gad, where he said most of the research was proved to have been done by students. That means there must have been mistakes, but later they were polished. Yes, KOFIH welcomes proposals as earlier on guided by Dr. Mona, and we have offices at our Ministry of Health, basement, and also at Mariba Building, Golf Course Road, Lower Kololo. The kind of proposals we normally want to sponsor must have tangible outputs. And I would actually advise you can go through these alumni, because we're here with these people here, but it's time for us now to network. Actually, on that front pew you're seated on, there's an alumni, the pioneer alumni seated on that front desk that actually you don't know. That is Miss Oling, who was, I think, our first alumni in 2017. Yes, she's a pioneer alumni. So, with her. Oh, okay. So please, you are seated in between the geniuses, the people who know what KOFIH really wants, number one. Then for KOFIH to extend its contribution to Mbarara Regional Referral, in the year 2018, the emergency unit at Masaka Referral Hospital was not what it is as you see it today. In 2018, I was part of the team that benchmarked at Mbarara Regional Referral Hospital by then. 2018-2019. And we had to borrow relief from Mbarara Regional Referral Hospital, and also looked at what these alumni had gotten from Korea, because the nature of the terrain and the landscape of Uganda and Korea is totally somehow different. So usually it's always good that you learn from home, then also compare the picture abroad, then you try to figure out something. So that's how we try to emerge and reach this kind of level here. And on the 10th of October, on the 10th of September 2024, KOFIH conducted a feasibility study at Mbarara Regional Referral Hospital. We met a number of people, including the acting hospital director and his team from the MAST EMS section and also the emergency staffs, because KOFIH thinks of extending its tribute to other parts of the country other than Masaka only. So we are still at the level with the feasibility study, but hope all goes well. Mbarara will be on board. But let's pray for it. I think that is it. Thank you so much.
Thank you so much, Emma, and thank you so much, everyone who has spoken, everyone who has walked this journey, and it's only the beginning. And finally, let me invite the lady who is going to lead us in a prayer. Come here and also pray for this project. Come here and pray not only. And after here, the next agenda is networking. Have you heard about networking? Please, all the alumni are here. They should give you their numbers. If any alumni refuses to give you their number, just talk to me. But use them for networking purposes. Is that okay? Yeah, don't start, I know some of you, a lot of business, I said this, no. Yes, stay yourself only with the ideas, how can we, networking. After here is actually networking, guys. Don't just run away. Take my number, give me yours, or I take yours, and we keep the connection. But we also have our WhatsApp platform. I hope everyone is on one, everyone who is here, Abraham and Rook, they should be at least on one of our platforms so that we don't lose people and we keep as a family. So you are going to introduce yourself, what you do, and then pray for us to close this. Thank you so much.
Thank you so much, Dr. Mugisha. My name is Mercy Bilibawa, and I'm a fourth-year nursing student and a member of MAST SWAG. So I would love us to, firstly, I want to appreciate for this initiative. It was a great one, and I would love to request all of us to stand so that we can honor the prayer. Thank you. Dear loving Father, as a group, we thank you for your support and your guidance upon this project. I thank you for the bright brains and the great people standing in amidst us. And I thank you for the guidance that you've given them to extend unto us and the community. The Bible says that through people, you extend your hand unto people. And I thank you that you have used the mate people are amidst us and us to extend all the necessities to the community. Father, I pray that this initiative doesn't just end here in this hall, but let everybody of us go ahead and you guide them so that they can extend the initiative to more people out there to help them with their lives. As we go back home, God, I pray that you protect everyone, you give them safe journeys. I cancel out the spirits of accidents and everybody will reach safely. In Jesus' name I pray and believe.
Thank you so much. I hope everyone has registered. Abraham, has everyone registered? Attendance? Yes, if kindly please we request. These are, otherwise, much as we arrive streaming, Coffee might say, but did this thing happen? Let everyone register, including Emma. Then we are good. We thank EYIT TV for the technology and helping us with this. And Rook, you have an announcement. Yeah.
The students, before going, I hope all of us you have my contact. So we shall issue out